Hey everybody, welcome to Pick Dr. Osborne's Brain. Welcome to the show. We've got a lot to talk about today. If you've got nutritional questions you'd like me to answer in the next hour or so, go ahead and start typing those in to the feed. And we're going to be talking a lot about vitamin B1 today. If you missed Tuesday's show, crash course on vitamin B1, in depth, all the big questions and answers there. If you're interested in the deeper dive, go back and watch Tuesday's show. But those of you who are back and you have questions, we'll get those answered today. Thanks so much for tuning in with me. Let's dive in. Lucy is asking, do some forms of B1 cause histamine issues or in this from mobilizing? No, I would not say that, Lucy. If you're worried about vitamin B1 creating histamine issues, I mean, unless you're allergic to a filler in it, it's not going to, generally the allergy to a filler could potentially drive a histamine issue, but B1 is not going to liberate oxalates or create a problem. And so it's not anything I would even consider if you're looking at taking vitamin B1. I love this next comment, which is Pepper says, B1 has done wonders for my Parkinson's shakes. We've seen that clinically a lot, actually. In people with Parkinson's where the tremor actually reduces with higher doses of vitamin B1. So thanks for sharing your experience with it as well. Let's see here. Can B1 supplements help with memory, and how much can we take safely take every day? Does it compete with other nutrients? So the question as to whether or not B1 can help with memory, for some it does. There are a number of research studies. If you watch Tuesday's show, I put some of those out there. But B1 is responsible for the production of acetylcholine, and as such, it's going to support the production of that neurochemical that allows brain cells to communicate, including brain cells that access memory. So, to answer your question, it's certainly worth a try. And if you're struggling, as far as the safe dose, the best way, in my opinion, if you're really trying to take what we would call a therapeutic amount of vitamin B1, if you're trying to achieve, improvements in health, I would highly and strongly recommend benfotiamine as the type of B1 that you take. That's not to say that you couldn't take other forms. There's one of the most popular forms in supplements is thiamin hydrochloride, HCl. And it works pretty well, but it doesn't work clinically anywhere near as well as benfotiamine. In my experience, benfotiamine works better than all other forms of B1. And if I were trying to decide which kind of B1 to take, I would land on benfotiamine in a heartbeat. As far as dosing is concerned, pretty good dosing is anywhere between 100 and 300 milligrams a day. Now, some people find that taking vitamin B1, because it works synergistically with magnesium, if you have a side effect profile with B1, I mean, if you're not tolerating it well, add magnesium, anywhere from 400 to 600 milligrams a day of magnesium to that. We find that by doing that, many people who say they don't tolerate B1 tolerate it perfectly well with that extra magnesium. Can B1 help for PTSD? Potentially. Let's see, I'm not sure I understand your full question here. Let me blow that up here. Hang on just a second, guys. I'm flying solo today, so I don't have my tech team. Can B1 help me for PTSD? What for and how much I have to take? Is there anything else that can help instead of medication? You should be looking at, if you've got PTSD, you should be looking into Ibogaine, Chatty. Just go do an internet search for Ibogaine PTSD. It was some really great research on using that, and it is a medication, but phenomenal outcomes with PTSD. As far as my experience with soldiers in PTSD has largely been measurement. So we measure nutritional status, we measure their vitamin and mineral status, and from that measurement, we make our recommendations. So depending on what a person has deficiencies of, is how we go about that process. So, the proof is always in the proverbial pudding. When you say, can it help for this? Can it help for that? Theoretically, it can. If we follow the biochemistry of what the nutrient does, theoretically, if that is in line with the problem that you're struggling with, then yes, the answer will be yes. But the proof is always in the pudding, so to speak, meaning start to try it. If it works for you, it works for you. And if it doesn't, it doesn't. Remember, PTSD and any other disorder are typically multifactorial. So there's going to be more than just one element involved in why a person has an illness. And there, of course, there's a lot of psychological component to PTSD. There's nutritional component to PTSD. There's certainly the potential for microbiome component with PTSD as well. Alterations in the microbiome are very common in people with post-traumatic stress. I lost a lot of nutrients after MRI with contrast. B1, B2, B7, calcium, potassium, magnesium, manganese phosphate, selenium, all went very low. I mean, gadolinium is a metal that it can, well, one, it can be hell on the kidneys. So it can affect the kidney function. And the kidney is very important in retaining nutrients and filtering nutrients properly. So if you've got, some kidney damage as a result of that dye, certainly it can impact your electrolytes like calcium, potassium, magnesium, etc. But also it can affect the other nutrients as well. But from a metal perspective, gadolinium can compete and block binding sites for many other minerals. So that would be another potential way that it could cause malnutrition. So two major ways. One, it affects the kidneys, which are responsible for reabsorption and maintenance of nutrition by filtering the blood. The other is that it can act as a kind of a competitive inhibitor of other minerals for binding sites within the body. I'm of the opinion that, I get people all the time in my practice that, we just say we have different opinions, and you're always entitled to get a second opinion about something. But a lot of doctors push for the gadolinium or the other contrast dyes in MRI or imaging. And because it enhances the image, it enhances the ability to see something. There's no doubt that those dyes can do that. However, risk benefit, is the risk of what that dye can do to your body worth the potential benefit of what a doctor may be able to see? And I'm of the opinion no. For dyes, for these toxic dyes that are injected into people, I just see them all the time. We get people 10, 12, 15 years out from a gadolinium test, and they still have toxic levels of gadolinium in them when we measure. So and I know that when you go to the doctor and you sign the waiver and everything else, they generally will tell you that gadolinium will be out of you in 2 weeks, and it's just not. We see it too frequently. And what's it doing? If you follow, I think it's Chuck Norris's wife was damaged by one of these dyes, these imaging dyes, tremendously damaged. You should go read about her story. Any one of you who are watching this or being told you need to go do imaging and have the dyes, think twice about it, maybe get a second opinion, because you can still, a good radiologist can still read an MRI, can still read a CT scan or an image and come back with a decent answer without the dyes. The dyes, yes, can enhance the view, but aren't 100% necessary. And so you have to take precaution there, especially if you're sick and trying to figure out why, because now you're injecting a foreign dye into the body that has the potential to do harm when you're already struggling. And this is where we see a lot of people go. Any tips for someone that has done gene testing and it says avoid high-fat diets because increasing risk of poor blood lipids? I don't buy that, Kim. I mean, first of all, a lot of these gene tests they account for human genetics, but don't account for microbial genetics. And you're outnumbered 10 to 1 at least by microbes. And the microbes they don't sit on the sideline and just watch what happens. They're actually active participants in the biology and biochemistry of how your body works. And so a lot of these genetic tests that people run to, and then they use this genetic information as if it's gospel, as if you don't listen to it, it's somehow you're doomed, your fate is sealed. I just haven't seen that clinically. That being said, I don't think it's about avoiding a high-fat diet so much as it is about the right kind of fat, and also define high-fat diet. I'm of the opinion that most humans, and there are variances for sure. We test for those variances, but most humans do really, really well on what I would call an equality diet. A third of your calories coming from fat, a third of your calories coming from protein, and a third of your calories coming from carbohydrate. The vast majority of Americans today are probably somewhere in the 60 to 80% carbohydrate range, meaning the vast majority of their calories are coming from carbs. And so their diet is relatively low fat, because fat has been pushed down our throats as a fear factor. And many people don't eat near enough protein because of the rhetoric against animal meats. And so they're on a low protein, low fat diet, high carbohydrate diet, which is why we have obesity rates that are sky high. And we have lab cardiovascular risk markers like hemoglobin A1C and insulin, and triglyceride values, and other markers around kidney function and blood glycation are through the roof for many, many people. So I'd worry less about that genetic test and worry more about how your body reacts to food with your experiences. And if you want to be preventative, read No Grain, No Pain. You want organic food, whole food, you want non-processed food, you want nutrient-dense food. You want to make sure you're going to bed on time, getting good sleep. You want to make sure that you're exercising. You want to make sure that you get plenty of sunshine on a regular basis without sunscreen, and that you breathe clean air and drink clean water. If you do those 6 things consistently, I don't care what your genetics say. If you do those 6 things well, consistently, it downplays most major genetic risk factors, unless you have a genetic inborn error of metabolism, which you don't, at least not if that's the gene you're referring to. I hope that's helpful for you. My question after benfotiamine, let's see here. Sorry, the comments update, and then there's so many comments, it's hard for me to do it without help here. And like I said, I'm flying solo. Could someone be tested normal for CRP and sed rate and still have, I assume you mean inflammation, Bonnie? And the answer is yes. You could still have inflammation caused by not just food sensitivity, but many things, if your CRP and sed rates are normal. Sed rates and CRP are just 2 mechanisms by which we can measure inflammation, but there are many others. Interleukins, interferon, TNF alpha are markers for inflammation. Homocysteine can indicate inflammation. MMP9 can indicate inflammation. TGF beta 1. So just understand that CRP and sed rates are fine. They're good tests, but they don't always depict the entirety of the inflammatory story. So good screening tests, but not necessarily foolproof. After benfotiamine was quite high in blood test, what would be too much? I'm not sure I understand what you mean. No doctor would measure benfotiamine in a blood test. So maybe re-ask the question. Is benfotiamine more likely to improve tachycardia over thiamin? In my opinion, and in my experience, yes. Again, if you're trying to use B1 therapeutically, benfotiamine is the superior choice. You guys have asked me in the past to talk about different supplements. I kind of brought a couple in today in preparation for that. But like as an example, this is what I have formulated. It's called Ultra B1, and it's benfotiamine. And 1 capsule is about 150 milligrams of benfotiamine. We generally start people on 2 capsules of that a day if they are struggling with problems associated with B1 deficiency, versus using a product with thiamine hydrochloride. Now, if you're using my B Complete formula, which is here, B Complete, if you guys can see that okay, That product, one capsule has about 100 milligrams of thiamine hydrochloride, different kind of vitamin B1. It's the water soluble version. The fat soluble version works better. It takes into cells better. It's not to say that the hydrochloride can't work, but you've got to generally go much, much higher doses. So if you're aiming at, if you suspect you have a beriberi-like issue, you need to really think about benfotiamine as your primary choice. A lot of people tell me they were taking a B complex, similar to mine or even mine, and it wasn't effective for their particular problem. And then when we put them on vitamin B1 as benfotiamine, they feel better. So clinically speaking, it's just my go-to. If somebody does the testing and we get back a vitamin B1 deficiency, we're aiming for benfotiamine 100% of the time, for that reason. It works better. Let's see here. I have celiac disease and my B12 is in the low range. My doctors refuse to give me injections even though I have neurological problems. Wow. Fire them and find a new doctor, Casey. I remain within the norms. Is the required B12 level higher? So, I mean, depends on the lab that they're using to run the test, but generally speaking, when you're looking at B12 on a lab, the reference range is usually somewhere between like 300 and 1200, again, depending on the lab. And some labs are lower ranges than that on the top end. But serum test is junk. It's not helpful because you get false norms, and you may have a false norm. I can't really comment as to whether or not you do, because I don't know enough about your history or about you. But if yours is, let's say your B12 is in the 350, 400 range, you don't need an injectable. If you have celiac disease, you can bypass the intestine and use methylcobalamin sublingually. This is basically, it's a lozenge, and you suck on it and put it under your tongue, and it absorbs through the buccal mucosa of your mouth and goes right into your bloodstream. So you might try that. As a matter of fact, I talked about this several weeks ago. Check out my course on vitamin B12, where I talk about sublingual versus injectable B12 and which one's more effective, and kind of give you the research on that. But sublingual is just as effective as intramuscular B12 injection. So any of you kind of on the fence there that are looking at picking one versus the other, always start with the least invasive, right? Because there's inherent risk to a needle injection. I mean, it's not tremendous, but it is risk. And why would you go with risk versus a sublingual with no risk? They can be just as effective. To me, it makes better sense to go with the sublingual. We actually have a product called methylcobalamin, and it's a lozenge. You have to watch out too if you're celiac, because most B12 formulations that are sublingual have grains in them. They have grain-based fillers, or they're sweetened with sugar alcohols that are corn derivative. And if you're new to this, Casey, and you haven't heard this before, celiacs react to corn. In our experience with testing, the vast majority of celiacs do very poorly with corn. It perpetuates the same type of antibody response as wheat glutens, and so you have to be real careful with products that do contain corn. And so a lot of B12 lozenges have like erythritol or malitol, which can be corn derivative. My formulation is strictly birchwood xylitol. Organic birchwood xylitol is what we use in our B12 sublingual. So if you're in the game for that, and you want to go check that product out, I encourage you to do that and try it. If potassium deficiency is the cause of tachycardia, how quickly would you expect to see results with supplementation? A matter of days. I mean, literally, very quickly, with tachycardia. Is B1 helpful for children with autism? Maybe. It depends on the child, and my credo is test, don't guess. Can it be helpful? I've seen it be helpful. Is it helpful for everyone? No. Generally, it's helpful for the ones that have low levels. So if you're looking to get specificity, the key recommendation there would be test first. And then you have solid data that says, okay, this is what I need to do. What's the right test for inflammation caused by food sensitivity? There's several. Bonnie, we have one on Gluten-Free Society. We're actually out of stock right now, but should have it back shortly. I'll put a link up for you so that you can go read more about it. But food sensitivity testing, you have to be careful because some companies test one element. There's multiple elements when you're looking at food sensitivity. There's multiple antibodies that can be produced. There's something called a T cell response. There's something called an immune complex response. And so all of these things, if you're looking at kind of getting an accurate, well-rounded outcome or result, it's important that you look at them all. But I'm going to give you a link. We're out of stock right now, but it should be back in soon. Let's see here. But if you go to this page, this is the lab category, the lab testing categories that we do offer direct to consumer at Gluten-Free Society. So for those of you who aren't aware, I just put that up and tag Bonnie in it, but you can all go check that out. If you're looking at doing, food sensitivity testing, gluten sensitivity testing specifically, or if you're looking to do vitamin and mineral deficiency testing. If you're low on iodine, what do you recommend? Depends on the person. Depends on how low they are. But if you're talking about kind of an initial starting point for dosing, if somebody came to me in my practice and asked that question, the answer would be about 12.5 milligrams per day. But there's context behind that. And that context would be, does that person have a bromine or a fluoride toxicity, which is something else we measure, because higher doses of iodine in somebody with bromine or fluoride toxicity can cause an exacerbation of symptoms. These are, if you've ever taken iodine and been like, wow, I felt horrible taking that iodine, you probably have fluoride or bromine toxicity and don't know it. Because what happens when you take higher doses of iodine, it displaces that fluoride and bromine, and your body's now starting to try to flush it out, and on its way out the door, it's creating a litany of symptoms. But so part of when we put people on iodine, part of what we want to assess is their other halides to see that they don't have, major issue with them as well, because then I can taper them, or I can start them at a much lower dose and taper them up more slowly, and also give them the information to anticipate a potential side effect or reaction, so that they're not taken aback. If you're healing while you sleep from chronic diseases, which nutrients are most needed? I don't understand your question. If you're healing while you sleep, it's too broad a question. What nutrients are necessary to help you heal while you're sleeping? All of them. So I'm not sure maybe what you mean, Melinda. Maybe re-ask your question. Which B1 should it be, since in Finland, Europe, it's impossible to buy thiamin? Here's only thiamin from Chinese hemp. I hate that for you, Anne. We're working on a dropship solution for Europe currently. So maybe be patient with us. Would a higher dose of B1, otherwise you have to, figure out a place. I don't know if it's illegal in Europe that you can't get thiamin because it's not made in Europe, or if it's just something that generally nutritional pharmacies don't carry there. Would a high dose of vitamin B1 be needed to treat tremors? Possibly. It depends on if B1 is playing a role in the tremors. There's a lot of things that can cause tremors, Christina. For example, folate deficiency, vitamin B6 deficiency, vitamin B2, vitamin B12, calcium, magnesium, potassium deficiencies. These are all things that can contribute to tremors. Gluten sensitivity can cause tremors. And a lot of people, they don't know it. They're trying to take B1 to treat their tremors, but in essence, they need to quit eating gluten, and their tremors might go away if they would just do that. So it depends on what is the driving force behind the tremor. Is osteoarthritis considered an autoimmune disease? No. Osteoarthritis is basically it's a traumatic overuse or traumatic underuse. So you have think of it in two ways. You can overuse a joint and so create damage to that joint from repetitive use. where it doesn't have adequate time to relax, heal, repair, and rest. You can also be sedentary, and you can develop osteoarthritis, because you're not moving the joint. And this is where most people fall. They don't fall in that, and I injured my back category. They fall in that I sit on my keister all day at a job for 8 hours, and then I drive and commute in traffic for 2 hours a day. So half of my day I'm sitting, and my spine's not moving, or my joints aren't moving properly. And when you don't move your joints, your cartilage loses oxygen and nutrition, because there's no blood supply to cartilage. It gets nourished through movement. And so most people develop osteoarthritis as a result of sedentary-like behavior, at least in today's society. So keep that in mind, because the path forward for osteoarthritis, the path most people take is, it hurts, therefore I'm going to stop doing things. I just had a conversation with someone this week in the practice about that, how they had quit exercising because their joint pain, their knee. And I was like, well, how do you ever expect it to get better if you don't move it? And they didn't understand that blood supply is necessary, or rather, nutrient supply is necessary, and the only way you get that into the joint is movement. There's no blood supply. So we gave them some exercises and rehabilitative techniques that they could use, kind of to move into lighter movement without the severity of pain, so that they could start getting nourishment into that joint. But it's so common. So many people are told they need surgery. So many people told it's because they're getting old, but in reality, it's accumulated sedentary behavior over time leads to degradation of the cartilage structure around the joint, and that's what usually gets diagnosed as osteoarthritis. But it's not autoimmune. Should I take acetylcholine? You can't take acetylcholine. Acetylcholine is what your body makes, Tana. So acetylcholine is the chemical produced by neurons to communicate with other neurons. And to make acetylcholine requires vitamin B1, it requires vitamin B5, and it requires the nutrient choline. So you need those 3 nutrients to properly make acetylcholine, but you don't take acetylcholine. That's not something that you take orally or supplementally. Do I understand correctly that most autoimmune diseases are treatable with a true gluten-free diet and appropriate vitamins and exercise? Yeah, that's a pretty fair way to put it. In my experience, both in my practice, but also in the thousands and thousands of letters we get annually for people that are applying the no grain, no pain diet in their lifestyle. I mean, I get no shortage of letters from people on a daily basis saying, no grain, no pain changed my life. I had rheumatoid arthritis and my pain's 80% gone. I'm off my methotrexate. I could stop my biologic. You name it. And it's not just RA, it's other things as well. My primary focus is a lot of the neuromusculoskeletal autoimmune conditions, things like RA and multiple sclerosis and others. But the same could be said of hypothyroidism, the Hashimoto's variety. We get reports all the time from people that their Hashimoto's antibodies dropped dramatically by changing their diet. I've even seen a case. Now, I'm not going to, and this is a bold statement, so before all of you start screaming at me with type 1 diabetes, please reserve it. I've seen one case where a grain-free diet led to a person's ability to get off of their insulin, and so they were off. So they were type 1 diabetic on insulin, changed their diet, were able to wean off of their insulin and discontinue it. I think they were off it for like 2 or 3 years, and then they needed to add some back a couple of years later. So it wasn't a full reversal, but it was a tremendous impact. I mean, how many people can say that about diet change in type 1 diabetes? Most people will tell you, most doctors will tell you, diet has nothing to do with it. It does. It actually has a lot to do with it, because we know that gluten-linked genes, the DQ2 and the DQ8 gene markers, are the same markers that we see in type 1 diabetics, and the prevalence between the two conditions is very, very, very associated, meaning that generally there's a much higher rate of type 1 diabetes in celiacs and vice versa. Does that mean there's a causal relationship? Not 100%, but going grain-free, I know for a fact, does this for all type 1 diabetics that I've ever seen. Number one, it reduces their need for insulin. So whether they're on an insulin pump or whether they're doing something like self-injection, their need for the insulin is dramatically reduced. And that's the goal. The end goal is to better control the blood sugar. The crazy thing in type 1 diabetes that I always see nutritionists and doctors even recommend is like control your blood sugar swings with candy. I mean, that's so stupid. Why would you want to control your blood sugar with candy? Candy's the enemy here. We want to control how much insulin that we need. We want to control how well the insulin we're having to inject ourselves with is needed. And the way we do that is through the management of proper diet and not eating candy so that you can regulate swinging back and forth. And you eat some candy and pump yourself with more insulin, eat some more candy. It's a yo-yo that never ends. And you have to understand that the more insulin you use, the insulin contributes to cancer over the long run. So the more insulin you use, the greater the risk for that. But insulin also contributes to many other forms of illness and disease if you overutilize it. So you want to be able to mitigate how much you're using. And the only way you're going to do that is through dietary control. And no grain, no pain works tremendously well. We've had multiple documented cases of patients who are able to cut their insulin needs in half or more by just simply changing their diet. And to me, that's still a fantastic success. We don't know how to cure type 1 diabetes as of yet. It may be coming down the pipeline, but no grain, no pain diets do dramatically well in helping these people control, and it also helps them feel better. They feel better in a lot of ways as well. So there are exceptions, definitely exceptions. Not 100% of all autoimmune diseases, I would say, I've experienced be so responsive to diet change. For example, the ones that I see most responsive to diet change, I'm talking about autoimmune disease, all forms of autoimmune arthritis, whether it's lupus, rheumatoid, scleroderma, dermatomyositis, ankylosing spondylitis, reactive arthritis, psoriatic arthritis, respond extremely well. Most forms of skin autoimmune disease respond extremely well. Vitiligo is probably the toughest one, and with that one, we've seen cases multiple where you can halt the progression of the depigmentation. You don't always reverse the depigmentation. I've seen some cases where they move backward and they start regaining skin pigment, but a big part of that depends on how aggressively far they are into the disease. Did they wait 30 years to get help, or did they get help right away? Alopecia areata responds extremely well. We've seen full reversal of baldness if we catch it early enough. I've seen cases where neurologically, MS, I've seen people get out of wheelchairs, so it responds really, really well to no grain, no pain. Parkinson's responds really well if you catch it early enough. So a lot of them respond well. Type 1 diabetes, probably one of the more challenging ones, along with ALS, Lou Gehrig's disease, very challenging to treat. And the reason why is all forms of autoimmunity are not just caused by grain. They're multifactorial. I mean, you've got categorical triggers. If you've watched my shows on autoimmune disease, this may sound like a broken record, but food, chemicals, microbes, and nutritional deficiencies are the primary trigger agents in autoimmunity. And I have a long lingering suspicion that the biggest reason we see the most autoimmunity, and it's on the rise, is because our food supply is being poisoned by food manufacturers. And I'm not saying they're ill-intended, although I have sometimes questioned whether or not they are or aren't. But they're certainly agents and texturizing agents and addictive chemicals for taste like that. None of this has been adequately studied, and the U.S. government doesn't monitor it or regulate it, and they let them kind of study themselves. And they're incentivized to create addictive, cheap foods. And most people, unfortunately, most people didn't get the memo that food's changed in the last 40 years. What you used to buy in a bag is not the same as what you buy today, even from the same company and the same brand. Most products are inundated with more chemicals than they are with food. And when you ultra process it, you destroy most of the nutritional quality. So you're eating calories without vitamins or minerals. You're getting chemicals, and your body has to deal with that. And you take a young infant growing up in today's world, what do you think is going to happen when their body is constantly fighting their food and not being nourished by it? That's what autoimmunity is. And I think if we could get the chemicals out of our food, I have seen that trend in decades of practice where, look, if you want to do some things, and people balk about the cost of functional medicine sometimes, and how is it, why is it so expensive? Testing costs money to perform some of the tests that we do, to get the detailed information to be able to better guide people. But if you want to just start on your own at home, like one of the cheapest ways to overcome autoimmune disease or to move the needle in the right direction is to just quit eating processed food. Cook your meals from whole, real, organic food, sourced locally, ideally, sourced from the grocery store if you don't have a good local source. But just do that one thing while going to bed on time, turning off your cell phones at night, getting sunshine amply throughout the course of your day, and exercising amply. If you do those things, you'll take yourself light years ahead of where you're at currently. We have seen that be a consistent truth in everyone that walks through the door. And that's a long rant, but it was a good question, Diana. Thanks for asking it. Medicine doctor is megadosing calcium in an elderly relative with constipation side effect. What vitamins is she likely deficient in? You got to test her. It's not about what's likely. Because I don't know anything else about her. She's being megadosed with calcium, which is the wrong move. Megadosing calcium can actually cause constipation if she's constipated. But was she tested? It's unfortunate. A lot of elderly women don't know that bone scans are junk science, and that you go to the doctor, they do a bone scan, and they tell you you have osteoporosis, and then they want you to megadose you with calcium, and then they want to put you on bone drugs. Bone drugs in the long haul increase your risk of fracture. They don't reduce your risk of fracture. They increase bone brittleness. They improve bone absorption of X-ray, so it makes your DEXA scan look better, but it doesn't actually improve the quality of your bone. But calcium's not the answer either, because osteoporosis is not a disease of calcium deficiency. Your bones are multifactorial. They need protein and amino acids. They need lots of different minerals, even beyond calcium. You need things like vitamin K2 to get the calcium into the bone. They need zinc and potassium and selenium and chromium and copper. Your bones need B vitamins effectively to help with the matrix of the formation and the energy requirements to make new bone. So it's not just as simple as calcium. Is LDL cholesterol at 112 considered high? Yeah, it is by mainstream for the most part, but you guys know maybe you know my opinion on cholesterol. It's a pipe dream. Lowering cholesterol doesn't work at reducing heart disease or stroke. Look at the data on it. We don't have less heart disease and stroke, and the top 2 prescribed drugs in the world year after year are both statins. So the aggressive approach to trying to lower LDL cholesterol has not led to reduction in outcomes of heart disease. Therefore, it doesn't work. Therefore, we've got to find a different way forward. Just because you were told it was true doesn't make it true. And we could say that about a lot of things in life. But anyway, is esophageal dysmotility an autoimmune disease? It can be. It can also be just muscular spasm. Esophagus has muscles around it, smooth muscle around it that help it contract and relax. And so, for example, electrolyte deficiencies of calcium and magnesium and potassium can actually create dysmotility problems in people, as can a variety of other things. I mean, food allergies can cause esophageal dysmotility. Gluten is a very common cause of esophageal dysmotility for people. And in that regard, it can be autoimmune, but it can also be malnourishment. How does vitamin B1 help dysautonomia? It helps in the production of acetylcholine. Understand that the primary neurochemical of the autonomic nervous system, if we're talking about parasympathetic, is acetylcholine. So you think of your autonomic nervous system as that part of your nervous system that is beyond your thought control. It's automatic, right? It's automated. So you have 2 arms. You have what's called the parasympathetic, and then you have what's called the sympathetic. Now, the parasympathetic fibers, the nerve fibers, require acetylcholine for that communication. So the way your spinal cord and brain talk to your organs parasympathetically is through acetylcholine. Whereas your sympathetic nervous system is largely under the influence of catecholamines like adrenaline and noradrenaline. So a little bit different. Now, part of their communication, if we don't want to get into that. You guys probably don't understand pre and post ganglion synapses, and so that I'll bore everybody out of the room. But there's some nuance to that, where acetylcholine helps with the sympathetic nervous system, but it is predominantly effective at helping dysautonomia because it's a major neurochemical involved in the regulation of the autonomic nervous system as a whole. Are there certain nutrients needed before and after having a CT scan? Avoid them, is what I would say. Ask for an MRI instead. CT scans like equivalent of 1,000 X-rays. It's so much radiation, and those scans are so abused. And it's a profit profit motive, in my opinion. You can get decent data off of an MRI, for the most part, just as decent as you can from a CT scan. But MRIs cost, $300, $500. CT scans can cost upwards of 10, 20K, depending on the situation in the hospital and whether it's urgent care or whether it's, an imaging center. But it's just too much radiation. You have to understand that the whole act of getting an image, I know this isn't your question, but I'm going to answer it this way. The act of getting an image, I understand it from the doctor's perspective. Why do I want to see a picture of this human on the inside? I'm looking for things like cancer. Maybe I'm looking for blood flow problems. I'm looking for torsional problems, or I'm looking for physical aberrations that might lead to a better understanding as to why this person is having the symptoms that they're having. So, like, as an example, maybe you have a herniated disc that's compressing into a nerve, and you've got arm neuropathy and you don't know why. And so that image might help a doctor understand, hey, you've got a disc pushing into your nerve. But most conditions, not all, but most, imaging is kind of the last thing that we'll do. We in our brains, we'll go through something called a differential diagnosis, where we'll think about all the most common things that could be causing the person's symptoms sitting in front of us. And then we'll embark upon that journey of recommendations. Now, in mainstream medicine, that embarkation is typically drugs to mask symptoms, right? Drugs to block things or mask symptoms, which I'm not a super fan of. I think there's a place for medicine, but I think it's too common, overly used. I'm a bigger fan of diet and lifestyle change, because most conditions are ultra responsive to diet and lifestyle change. So you have to ask yourself, have you done that yet? Before you go get, 3 CTs with dyes and worry about taking, 5 or more medications because, your doctor's just trying to be empathetically helpful by blocking your pain or helping you to resolve your symptoms but you have to understand, they're not solving your problem. Solving and resolving are not the same thing. And most of the time, diet and lifestyle are going to correct the vast majority of chronic inflammatory problems people have. And that's, think of that as any form of autoimmune disease, most forms of heart disease, most forms of metabolic syndrome, or other, cardiovascular related problems. Like, diet and lifestyle change is more effective than medicine. We've known that for years, because these are diet and lifestyle induced diseases, but people aren't being told that. They're being told they need to go get a CT scan and be on these medications because it's more profitable. And you have to understand that medicine is a business. People don't realize this, that, that hospitals are named after saints, and named after churches. And so there's this disconnect between people's brains understanding that medicine is a business. It is a for-profit business. Hospitals want to make a profit. Doctors' offices want to make a profit. That's not to say they can't also be good people or good practices and do good work, but there's a profit motive. And you have to keep that in mind when they're making recommendations, especially when it's test after test after test, and it just becomes a whack-a-mole situation. It's always good to get a second opinion from somebody who does functional medicine. If you're in that arena of mainstream medicine and you're frustrated with how things have gone and you're not really getting any answers, and they just keep wanting to run more tests, but no answers are coming, and you don't want to just solve your problem with drugs and forget that there's an underlying issue that's causing the problem, and the drugs are not the long-term solution, then you really need to philosophically go see somebody who practices functionally, because that's where you're going to get more of an answer. I think we're in the middle of a medical revolution at this point. I mean, it's starting. It's not in the middle. Maybe not in the middle. We're at the beginning of it. People are fed up. I mean, look at your insurance rates. They're going through the roof, and they're about to go up again. Drug prescription costs are sky high. Americans spent $4.8 trillion last year on healthcare, but our health is ranked last among industrialized countries. You know, medical systems that are considered state of the art. So how are we ranked last, but we spend way more than any other country? It's because our for-profit system is highly incentivized to order more tests than what are necessary, to order more treatments than what are necessary, and to do more interventions when diet and lifestyle interventions would be enough. And that's just where we're at, because a lot of people that you know would rather take a pill than to go to the gym. A lot of people that you know would rather take a pill than to go to bed on time, or they'd rather take a pill than to go outside and get sunshine. Like, they are not taking care of themselves, and so they're passively just throwing their responsibility over to a stranger who's going to give them a pill, and they're going to pay a price for that, because there are no free lunch meals. There's no free tickets. You're robbing Peter to pay Paul when you're taking medication to block symptoms without addressing the underlying reason as to why the symptoms exist. Anyway, all that about a CT scan question, but I felt like it was necessary to say. Can miso and Bruges soup replace vitamin B? Is caffeine free? So I don't recommend. I mean, miso, yeah. I mean, you could get B vitamins from miso. I don't recommend Bruges. It's too processed. There's B vitamins in it, but I don't recommend it. Is caffeine-free coffee better for you? It's not that it's better for you. I mean, caffeinated coffee is okay. If you keep your caffeine to 120 milligrams a day or less, somewhere in that neighborhood, there's a lot of really great evidence that caffeine on a daily basis through a cup of coffee actually expands longevity in life. Where people get into trouble with caffeine is they're pounding energy drinks. They're drinking 3 to 5 cups of coffee a day, right? It's quantity versus just demonization. We don't necessarily need to demonize caffeine. What we want to understand is if you're having to rely on caffeine as an energy substrate, and you're the person that drinks 2 energy drinks in the morning, a pot of coffee at lunch, and that's abuse. Now we go into the realm of food as beneficial versus food as something we use as a crutch that becomes abusive, and that's where I would put coffee in that mix. Is non-HDL cholesterol? Quit asking questions about cholesterol. This isn't to pick on you. It's just simply to say you're focusing on the wrong target. When you aim at the wrong target, you're missing regardless. Cholesterol should not be a target of therapeutic approach in health. That's just my opinion. Go watch my video on the cholesterol myth if you want to have more insight historically as to the numbers of cholesterol and how that's been manipulated, and how cholesterol demonization even came to be. It was the whole mantra of cholesterol was built on shoddy shyster science. I mean, honestly, go look up Ansel Keys in the 7-country study. What you'll find is that it wasn't a 7-country study. It was a 21-country study, and they threw 14-country data out, and they kept the 7 that matched their narrative. They wanted to cherry pick the data and make fat and cholesterol the enemy, and they did. But fat and cholesterol are not the enemy. Cholesterol is your mother hormone. It is the precursor to every steroid: estrogen, progesterone, testosterone, DHEA. You cannot make those things without cholesterol. You need cholesterol to make brain synapses. It's a very important molecule, and lowering it is not going to help you unless you have an exception to the rule, unless you have chronic familial hypercholesterolemia, which is a genetic disorder, in which case there may be some merit in lowering it. Will vitamin B6 reverse carpal tunnel syndrome, or is surgery the only remedy? No, B6 deficiencies can cause carpal tunnel, Mary. B6 is a natural diuretic. It's actually one of the functions of vitamin B6 is it behaves as a diuretic. And so what happens a lot of times in that carpal tunnel, here in the wrist is you'll get swelling because you're not controlling water properly, and that increased pressure or water around the carpal tunnel will compress the carpal nerve, or the nerve, the median nerve running through the center of that tunnel, and it will cause that radicular type symptom. And so B6 for many people can help to resolve that. Now, there are other things that contribute to carpal tunnel. Surgery would be the absolute last remedy, in my opinion, but I've seen hundreds of cases of carpal tunnel just completely go away with adequate B vitamin supplementation and diet change. So surgery is a last resort, not a first. How do you get gadolinium out of the body after MRI with contrast? The best way is to chelate it out. And there are a number of different things that can be used as natural chelators. I actually have a formula that I like to recommend people support their body's detox with. It's called Ultra Metal Detox. What does it mean when you have trace leukocyte esterase? Well, that's a urine test, and so it doesn't mean really anything at trace levels. It could mean that you have either the beginnings or the endings of a urinary tract infection, but ultimately it means that you have white blood cells secreting chemicals, and those chemicals are showing up in your urine. So you see that, and you're having burning pain on urination, and you suspect a urinary tract infection. Well, that's what it alludes to. Yeah, all the people that are taking methylene blue, they're going to regret it. We have. Let's say health is a lot like politics. In politics, you have far leaning left and far leaning right. I don't care where you're at. This isn't a political show. But in health, we have a far leaning left and a far leaning right. And the far leaning left would make you think that your body is inadequate and that your genes are not a gift from God, and that you're a broken human that requires human intervention and medical intervention to sustain any semblance of normal health, which is total BS. But that's what we would equate to the far left. And then the far right is these fringe folks on this side saying, take a bunch of chemicals because it's going to improve your health. Like things like methylene blue. And I've even seen now, the nicotine is becoming more popular. Look, nicotine is a drug, and it causes nutritional deficiency, and it's very addictive. And if you're taking high doses of it, you're going to regret it. Is it a stimulant? Is it going to bind to your nicotinic receptors? Yeah, it is. Is it going to make you feel better? Yeah, it's a drug. It does increase the release of certain neurochemicals that help you feel happy and better. But is it a long-term solution that you should use as the answer to your problems? No, you don't have illness because you have nicotine deficiency. And that's fundamentally, you've got that far right side that's bringing in a lot of these things, and they're saying take these things to solve your problem. Well, I'll just put it like that. And then you have what I call logic and common sense, which is your body was born with the gift to know how to heal. There's innate intelligence within it. And generally when it's broken or when it's failing you, it's because you're not doing your part. And focus on what we call the 6 non-negotiables: the right diet, that's clean, eating real food. Number 2, go to bed on time, get real sleep. Number 3, exercise. Number 4, sunshine. Number 5, drink clean water. Number 6, breathe clean air. You're doing those 6 things consistently, your body knows what to do, and it'll take care of you. If you're not doing those things, ask yourself why. What is the impediment that's blocking your ability to do the things that are structurally and fundamentally sound and not negotiable for if you're trying to achieve health? And if you're not doing those things, you can gravitate toward lots of treatments. You can gravitate to that far left, you can gravitate to that far right, but ultimately both of those are pipe dreams. You have to be the person in charge and responsible for taking care of yourself. Now, there are certainly exceptions to situations. If you've got a fractured arm, you may need an orthopedic to pin it and put it back together for you. If you've had traumatic injury or something along those lines, we have the best medical care in the world. I'm not talking about good common sense medical care. I'm talking about fringe ideologies that have taken over and created a divide amongst people. Like there's a tremendous rift amongst people because the people on the far left don't want to believe people on the far right, and they argue with each other, and it's all a distraction. Like let's quit arguing with each other, and let's just all acknowledge that you have the ability to be healthy if you take care of yourself, and let's start there first, and from there we can branch out to these other avenues of potential advancements of medicine or of natural medicines, etc. But start there first. If you don't start there, you're wasting your time with either of those other equations. Let's see here. My experience in standard of care medicine, looking for normal stuff, was as far as it went. Couldn't get an answer. Issue was ignored or in my head. So glad I was able to get out. I'm glad you were able to get out too. Is it advisable to take mycobinders while taking or doing a 5-day water fast? You can. You can do both. If as long as you're tolerating it, it's okay. But if you're using mycobinders to bind mycotoxins, you need to make sure you're out of the mold. I mean, that really is the most important thing. Let's see. Valentina is asking, how differently are NAC, milk thistle, and choline for helping the liver? Which one is more effective? It depends on the person. Cysteine, NAC, is an amino acid that can be measured, so you can predictively, understand whether or not a person will benefit from that by measuring it. The same thing is true of choline. Choline can be measured. Milk thistle is an herb, and the active ingredient is something called silymarin, and it's just extremely helpful and regenerative for liver cells. So anyone could benefit from milk thistle, in my opinion, if you've got a liver problem. But NAC and choline, although both can be very helpful for the liver, you should measure. And you could add inositol to that list. You could add glutathione and selenium to that list of things that are super important for the liver to function. You could add methylated B vitamins to that list for their role in detoxification pathways. So it's largely dependent on the person, and I'm the biggest advocate of test don't guess, because those are all great things you could do, but if you're trying to move the needle for yourself, then you should have a deeper understanding of your biochemistry to be able to do that effectively. Let's see here. What kind of vitamin to help eye pressure? They gave me timolol. I read all the side effects, which made me nervous. The alternative is laser. I mean, if you're trying to support your eyes, go, Mariko, watch just type in my crash course on eyes. I did an entire show on the nutrients for eyes. But just to give you a few to chew on, vitamin A is probably one of the most critical. Well, vitamin A not as beta carotene, but as carotenoids, but vitamin A as retinoic acid in its pure form. Vitamin A very helpful. Also, zinc. Zinc carries vitamin A to your eyes. Your eyes require a tremendous amount of omega-3 fatty acids for proper function, as well as antioxidants. So antioxidants, zinc, vitamin A, omega-3 fatty acids, and don't leave out sun exposure. They're actually seeing eye damage be reversed with red light therapies, and you get that free from the sun. A lot of people want to go buy a red light box and sit in front of it, but just go outside. I mean, you've got the freest, most awesome medicine in the world by going outside and taking in the sunshine without sunglasses on, without sunscreen on. Of course, be common sense reasonable about it. If you're eating well, you won't burn as aggressively. If you're eating a bunch of seed oil, you'll burn super fast. Somebody commented the other day, well, I'm redheaded and freckled. Yeah, that's fine. I am too. I actually have strawberry blondish hair, but when I was a kid, it was red and had a lot more freckles than I do today. But when I changed my diet, my skin tone changed and my ability to tolerate sun changed. I could stay out in the sun a lot longer and didn't burn. So changing your diet is going to have profound impact on your resiliency to sunshine. If you're eating low nutrient foods with highly combustible and highly oxidative seed oils, then those very oils are going to incorporate into the cell membranes of your skin cells, and they're going to oxidize more easily when they're exposed to UV radiation, leading to burning. But if you eat well, you're more resilient. And so you can soak in the energy from the sun like your body was intended to do. Your body is a battery and the sun is the charger. And so think of it that way and go get that free medicine every day. Is there a niacin with no flushing that doesn't harm the liver? Yeah, you could do niacinamide. You could also do, I like NAD. We have a product called Graceful Aging, which is NAD, and which is a form of vitamin B3. That's what niacin is, but it doesn't cause any kind of flushing. Do you mill? I don't mill. So the question is, do I mill my own wheat? Can bread be okay? Maybe you're asking, do I mill wheat, or can you mill your own wheat? I'm not sure, but look, if you're gluten sensitive, I don't recommend you mill your own wheat, because if you're gluten sensitive, you're going to react to it whether you've milled it or somebody else milled it. If you're not, you could mill your own. You certainly could break it down yourself. It will be a lot fresher and a lot more nutrient dense if you did it that way. But if you're celiac or gluten sensitive, you shouldn't be eating wheat at all. I know the whole thing right now is everybody's saying go eat the grains from Europe and you can do okay and be okay. They're less glyphosate in Europe, and so there's some truth to that. Some people are reacting to glyphosate, not necessarily those people are not necessarily gluten sensitive. That's why we test. When we're looking to see whether or not somebody should avoid gluten, I want to know. I don't want to guess, because it's a big ask. You're asking for tremendous change in their lifestyle and in their practices. So you'd want to know whether or not that was the right move for them to make. So get tested. If you're not sure, go get tested. We offer that testing. I put that link in earlier to Gluten Free Society. You can go get tested and then get an answer. And then if you are gluten sensitive, then put the bread out of your head and move on with your life and get healthy. I've read that magnesium depletes calcium in the bones. I don't know where you read that. That's not really entirely true. Is it still okay to supplement with magnesium for brain function and for brain fog and chronic fatigue syndrome? It's okay, Ann, but you should really aim to figure out why you have chronic fatigue syndrome. If you haven't figured that part out yet, really want to encourage you to focus on doing that. Have you checked for mold? Are you gluten-free? Are you grain-free? Those are really probably the most important two first steps I would recommend with anybody with ME or CFS to embark upon to see if that leads to either a resolution or tremendous improvement. It's just my experience over the years that those two things are the top drivers of chronic fatigue. I tried B1 for my long COVID in the benfotiamine form because I heard it was helping some people. It made me much worse. Is there any explanation? Start at a lower dose and add magnesium to it. And then go look for the mold, because most of the cases of people that I've seen that have been told they had long COVID were actually being exposed to mold in their home. And once we found it and dealt with it, they recovered. So, go look for the mold. Would it be fine to take 2B complex from Gluten Free Society for a while? I'm feeling so much better with energy. Yeah. I mean, there's no harm in taking B vitamins. They're short half-lives. You're not going to have a toxic a toxic reaction to B vitamins minus, one type of B6, which is called pyridoxine hydrochloride. Some people have, at super high doses, can have negative reactions to that particular type of B6, but that's pretty rare. And in the dose, if you take reasonable doses, you're not going to get in that trouble. Can you take a multivitamin and a B complex together? Yes, my wife does every day, Jenny. My wife doesn't like me to talk about her online, but that's why you guys never see any kind of photographs or pictures of her. That's by design. She likes to keep her privacy, but she does really, really well on the combination of multivitamin and a B complex. And if she stops one or the other, she really notices her energy will go down. And when we test her, it's always B vitamins. She's always got several different B vitamin deficits, especially if she goes periods of time without taking her supplements, which everyone does, right? We all go through ebbs and flows, ups and downs when we're taking supplementation. But when she's consistent, her energy is also consistent. But yeah, it's perfectly fine to take those two things together. Let's see here. What does gluten do to a person? Well, there's over 100 different conditions medically that are linked to gluten sensitivity. So gluten causes inflammation, if we're just going to simplify it. If you're gluten sensitive, it will drive the inflammation in your body upward. And that inflammation will lead to detriment to your different tissues and organs over time. And it'll lead to, ultimately, for many people, a diagnosis. So, classic example of gluten affecting the brain would be depression and anxiety. Those are classic symptoms of gluten in the mind. Some people develop epilepsy or seizure disorder. Some people develop something called cerebellar ataxia, which is a dizziness, tinnitus, and vertigo. Those are all neurological manifestations of gluten, generally in the brain or in the central nervous system. And then you can also develop external peripheral nerve issues. You can develop peripheral neuropathy from gluten. We've seen cases of ascending paralysis and even autoimmune, misdiagnosed autoimmune conditions like MS that were just being caused by gluten sensitivity. You see joint pain caused by gluten sensitivity, a non-alcoholic fatty liver damage caused by gluten, Hashimoto's thyroiditis caused by gluten. And these are all linked. I can tell you may be new here. So what I would really encourage you to do is I have several videos on in depth more about the symptoms of gluten sensitivity. Start with those and watch those. And if they appeal to you and look like you think you might be having an issue, then certainly certainly consider gluten. And then I'm going to put a link up for you here. This is just a quiz, and any of you can take this quiz. I'm going to just put a link in the feed. Simple to do, but it's a quiz. Answer the questions honestly, and what it'll give you is it'll give you an answer around whether or not you could be gluten sensitive. Yeah, let's pull it up here. Give me just a second. Here we go. I'm going to put that in the feed. Under gluten quiz. So any of you that are new, maybe you're not gluten-free, maybe you suspect gluten may be causing some of your problems, take that quiz. If it comes back positive, that hopefully will send you down the right direction. Can I take B1 with magnesium? Which one? Ultra MG. You use our Ultra MG. It's a multi-blend magnesium product. Works really, really well. Absorbs really well. Doctor just prescribed Magtine for sleep. Any thoughts? I mean, it's magnesium threonate. It's going to pass the blood-brain barrier more readily. It can help with sleep for some people, and others not so much. Try it. It's not a bad recommendation if you're looking for a way to calm the mind and get a good night's sleep. Certainly worth a try. But at the end of the day, if you're not sleeping, always go back to causation, folks. Why? Why aren't you sleeping? Is there a reason? Is it a magnesium deficiency? If it is, magnesium threonate is going to help tremendously. Well, if it's not, you might get a therapeutic benefit in the short term. But if you're not looking for the reason why, you're going to become dependent upon taking things to calm your mind to go to sleep. So what is it that is affecting your ability to go to sleep? That's the bigger and most important question that you can ask. Can B1, thiamine hydrochloride, and benfotiamine be taken together? Yes, they can be. Is serine better than glycine for activating the GABA receptors? I'd put them in kind of, I'd actually say serine is probably a little bit better, at least in my experience, for activating GABA. Yeah, glycine crash course is forthcoming, Helen. So, yeah, be patient. We got it coming for you. Let's see. Is buckwheat a grain or is it a seed? Buckwheat is a pseudograin, meaning it's not a grain technically. So there's technically no wheat gluten or grain gluten in it. That being said, it's typically processed with other grains and oftentimes cross-contaminated. And there's also some evidence that we have been documenting over many years that show cross-reactivity, so that buckwheat, people that are gluten sensitive actually react to buckwheat because of the similarities within the protein structures. So as a general rule of thumb, we don't recommend it. And if you follow along with No Grain, No Pain, we don't recommend any of the pseudo grains. Buckwheat, quinoa, and amaranth are the three that are commonly recommended as gluten-free substitutes, but it's our experience clinically that people don't do well with them and continue to struggle if they try to replace those things with other things that contain, wheat, barley, or rye. I've tried B1 for my neuropathy, 400 milligrams daily. Did you do benfotiamine or did you do thiamine hydrochloride? Because benfotiamine might be a better option. If you've tried benfotiamine and you're still having a neuropathy, you need to get tested, because you could have, neuropathy can have a lot of causes. You can have other B vitamin deficiencies that drive neuropathy. Lipoic acid deficiency drives neuropathy. Choline deficiency can drive neuropathy. So those are all possibilities. Outside of that, there's a lot of other potential reasons people can develop neuropathy too. Chemical-induced inflammation of the nerve, food-induced inflammation of the nerve, microbial imbalance, where you're generating endotoxins in your gut that are, traversing into your bloodstream and creating neurological consequences. So there's plenty of other things that could drive it. If you've tried that, and it didn't work, you can try some of those other things, but ultimately, if it's not going away, you should get tested. How can I get B6 without supplementing? Eat meat. B6 meat's a rich source of B6. Which magnesium is used with B1, please? I'll put a link up for you, Sharon. I recommend a product called Ultra MG. It's a tri-blend of magnesium, meaning it's got multiple forms. So it won't cause some when you get higher dosing magnesium, some types will cause loose bowels or diarrhea, and obviously you don't want that. So I'm going to put a link in for you here, and you can go read about it and check it out. Let's see here. What does it mean when you get a moderate calcium oxalate crystals? It means you've got high oxalate coming out of your urine. It can mean a lot of different things. It can mean you're dehydrated and you've got crystals coming out because you're not flushing out well enough with enough water. It could also mean that you have a yeast overgrowth. Yeast can produce oxalate internally and drive up oxalate crystal. It can mean you have B6 or zinc deficiency. Because those are necessary to break oxalate down and to cycle it. It could mean that you are eating too many oxalates in your diet and your body can't process them as effectively. It could mean you have a microbiome that's not capable of breaking oxalate down and your levels in your blood and urine are going up. So there's a lot of potential possibilities there. Can beet green supplements give falsely okay levels of B1 on an INA test? No. So if you're using oat testing to measure vitamin deficiency, you're wasting your money. It's not good for that. The test is too, oh gosh, it'll fluctuate from day to day. Any kind of test where you're using just plasma, urine, or serum to measure nutrition is not going to be super accurate. INA is far more accurate way to understand it, but taking in B green is not going to give you a false normal. I just would say the oat test is probably inadequate as a tool to try to measure. Can you get by with a lower dose of quercetin with zinc to improve loss of sense and smell in someone who's taking an anticoagulant? I mean, depending on the anticoagulant, quercetin and zinc are not necessarily going to interact with it. You certainly would want to take them apart from each other, but so I mean, I don't know why you'd want to. Again, talk to your doctor about your medications. Is senna good for chronic constipation? It's not chronically. It's fine for like acute constipation resolution, but I wouldn't use it chronically. I'd figure out why you have constipation, and that's true of any herbal. You don't want to have to take things long term to have a bowel movement. Ultimately, you want to know why your bowels aren't working properly, and it's not because you have a senna deficiency. So chronically, no. Acutely, yes. Short-term relief, but dig into why. Last time I checked, you don't ship internationally. Any chance that might change? Yes, we're working on it. I've been saying that a while, but we are working on it. Is it safe to take iodine with hyperthyroidism and goiter and nodules? Maybe. It depends on the person. That it would be largely dependent on testing. I wouldn't take it if you were on your own. I wouldn't take high doses of iodine if you've got Graves' disease without medical supervision. You should watch the interview, Christina, that I did with with Dr. Brownstein. If you type that in on my YouTube channel, you should be able to pull it up. Let's see. Yeah, if you're trying magnesium and you've had multiple different types that you've tried, and they're all creating a laxative effect, you probably have enough magnesium. There's probably no additional benefit to doing more. Vineet says well, you're taking a laundry list of things. If you're taking all that stuff and your parents have more energy than you, go get tested, because you're shooting in the dark. You don't know that those things are going to be helpful for you. You suspect they may, but they're obviously not helping you in the way that you want. So generally, let me say, if you're struggling and a lot of people will just try to figure it out on their own, and that's okay. I think it's the first smart step, is be attentive and pay attention to how you feel and how things affect you. But if you're struggling and failing, consider testing beyond that. Testing can be a game changer and put you on the right path when guessing's not. So Himalayan tartar buckwheat, no, I don't recommend it on a gluten-free diet. If you're on steroids, that's probably your sleep problem. Corticosteroids are stimulants. They'll keep you awake. So why are you taking them? Why do you need to take them? That would be the biggest question to get answered. Gluten. In what ways does gluten impact dental health? It causes a autoimmune reaction against your teeth enamel. So it erodes the enamel of the teeth, increasing the risk for caries. It can also contribute to inflammatory gums. So that of course is going to lead to poor dentition over time, and potentially tooth loss and infection, among other things. So not good. And then the malabsorption of nutrients leads to tooth decay. Have you heard about the difference between vitamin deficiency and functional dependency? If you're talking about functional dependency, as in you're taking high dose nutrients as a medicine to address the symptoms of your illness, you have to be more specific on what you mean by functional dependency. So there's two ways to think about it. You can use a vitamin or a mineral or nutrient at high doses therapeutically to bring about a biochemical change to improve a person's symptomatic outcome, which is what I would call green medicine. You're using something natural to improve symptoms, to help a person feel better. But green medicine and allopathic medicine aren't different. Not really, not at the core of the philosophy. The true philosophy that I encourage anyone to explore isn't how do you take this nutrient at mega doses to feel better. It's why am I not feeling better? And if you can answer the why and you can resolve that, then you don't need to worry about high doses of this supplement or high doses of that supplement for the rest of your life indefinitely. Alrighty, we'll do one more here. For those of you asking about testing, I thought I put a link in there a minute ago. If you want to get nutritional testing done, I'm going to give you a link to our lab testing information page. you go. Go read more about it there. That test, that nutritional test, is called an INA. Yeah, I've talked about it all the time, but that stands for intracellular nutrient analysis. And that type of testing is going to give you a really good, accurate indicator of nutritional changes that you need to make, and get you in the right direction. All right, last question. If gluten causes hypothyroidism, would it go away when and if you go gluten-free? You have to understand that gluten can cause hypothyroidism, but it isn't the only cause, right? Gluten is not a catch-all for every disease. You have to understand that when we talk about diseases today, modern diseases, the vast majority of them, if we're talking about chronic disease, autoimmune disease, they are inflammatory. What does that mean? That means that your body is inflamed and it's breaking faster than it can repair itself. And where the inflammation is occurring is generally how the disease gets diagnosed. So like if the inflammation is occurring in your thyroid, that's going to get diagnosed as a thyroid illness, usually, Hashimoto's if it's low thyroid autoimmune, or Graves if it's hyperthyroid. If the damage is occurring, if the inflammation is occurring in your liver, then you can get a diagnosis of non-alcoholic fatty liver disease. If the inflammation is occurring in your skin, you might get a diagnosis of eczema. If the inflammation is occurring in your joints, you might get a rheumatological, diagnosis like rheumatoid arthritis. If the inflammation is occurring in your nerves, you might get a diagnosis like multiple sclerosis. In essence, gluten can affect any tissue in the body. Most people only know gluten by its damage on the intestine, the small intestine, and there's a disease called celiac disease. We know gluten can cause celiac disease, and most people, that's where their knowledge ends. And this is also true of many doctors. That's where their knowledge ends. They think, oh, if you don't have celiac disease, you don't have to worry about gluten. Not true. Gluten can cause a plethora of different diseases. There's a whole phrase in medicine, and it's used diagnostically. It's called non-celiac gluten sensitivity, NCGS. If you haven't heard that term, I'm glad I was able to share it with you today. But gluten causes inflammation in multiple tissues. And because it does, it can cause a plethora of different symptoms. And if you go gluten-free and your problem goes away, then the answer to that question is yeah. If you go gluten-free and your Hashimoto's antibodies go away and your thyroid normalizes, then yes, your thyroid condition was being caused by gluten. If you go gluten-free and your thyroid condition improves but doesn't fully go away, meaning maybe your antibodies drop 1,000 points, maybe your ATPO is above 1,000, and when you go gluten-free it drops down to 200, and you feel better and you have more energy. But there could be other things also contributing, right? Disease is multifactorial. It's very rarely is it a smoking bullet where it's just one thing that a person changes and their whole life turns around. Usually it's multiple things. And remember, disease is repair deficit. Your body is breaking down. Inflammation is occurring at a faster rate than your body can cope or adapt or deal with it. So there are a lot of things that play into that. Your nutritional status plays into that. Your sleep status plays into that. Whether you have some other type of chemical exposure or environmental exposure is going to play into that. So this is why testing is so important. Those of you that are at home and you've struggled for years and you're frustrated with your doctor and you're not getting answers, it's because the type of testing they do it's diagnostic centric in the sense they're looking for what to call your illness, but they're not looking for what causes your illness. And that is the fundamental problem in medicine today. You can't look for the name of what to call it without understanding why it happens. But that's not the system we work in and live in. You guys got to understand that. That's why I said earlier, if you're frustrated, you should get a second opinion from a good functional medicine practitioner and move yourself into a scenario where you're moving the needle in your favor and not just masking your symptoms. I just can't emphasize that enough. Don't mask your illness. Don't put your head in the sand. Don't give yourself duct tape as a solution to a complex problem that diet and lifestyle could change and dramatically improve your life and reverse your illness. But a lot of these conditions can be reversed. There are nuances and differences. It's not Some are more challenging than others, but um, as a whole, any condition can be improved by diet and lifestyle change. I'll say that all day long. I'll never take that statement back. Any condition can be improved with diet and lifestyle change. Anyway, I hope that helps. So, in a wrap up here, we'll be back on Tuesday with another Dr. Osborne's Zone show. You are so inclined to continue your education with me at 6 p.m. Central Standard Time. And I'll be back here again on Thursday with a live Q&A, as we are every week at 12:30 Central Standard Time. So if you're new to the show today, welcome, and you're always welcome back. If you're new and you would like to get more information about how to conquer chronic inflammatory illness through diet and lifestyle, visit me at glutenfreesociety.org. That's our hub. And you'll get, if you sign up for our newsletter there, you'll get all kinds of wonderful free information about how to navigate autoimmunity and inflammation with diet and lifestyle change. If you want to support us, the way you do that is go to Gluten Free Society. If you're looking for highly gluten-free products, if you're looking for supplements of high quality and caliber without junk fillers, use our products. That's how you support us. That's what keeps the lights on at the Dr. Osborne Zone. So we appreciate your patronage. We appreciate you coming back week after week. And also remember our mission. It's to save 100 million lives. And the only way that we can do that is sharing. As the old rhyme goes, sharing is caring. If you found this show helpful and useful, you probably have friends or family that would also find it helpful and useful. Share it with them. Together, we can get the word out and we can help create the revolution in this country that's necessary to recapture the health of the nation and really the health of the world. If you're chiming in from somewhere else other than the US, you're in the same boat we're in. We have bad health, we have bad medicine, we have well-intended but bad systems for doctors. And the only way out of that is to demand better and to demand more, and demand that we look at the things that matter the most. And the only way to do that is we band together. So thanks for being a part of it. Appreciate you all. Hope you have a fantastic weekend, and we will see you on Tuesday. Take care.